All right, next question is from Jessica. Hello, Jessica. All right, so since the how, when, if of students going back to school is a big topic right now, yeah, don't I know it? Don't you know it? Yeah, imagine you've had this topic brought up by more than one person. Does that sound right? That sounds very familiar to me. All right, so I was wondering if there's any data indicating what the various numbers or cases, positivity rates, hospitalizations would need to be for it to be safe, or at least safer to send children back to school. Yeah, okay. And I saw that New York was going to monitor certain data points to decide when to open schools and when to close schools, etc. They're trying. That's what I can say here. They're trying. So there are ways with why can't I think of the word for it? But it's where you use mathematics to predict the outcome of an infection. It's like data, but for the future. Yeah, epidemiology, but in the sort of predictive mathematical modeling. Oh my gosh, there we go. All right, pulled it out. Yeah. So there are ways with mathematical modeling to try to estimate this, but it depends on your assumptions that are underlying your model, which is a fancy way to say that you're dealing with a lot of unknowns. And so you have to at least get a ballpark value for each of those unknowns. And then a ballpark is a big place. And so if there's a lot of variation possible on those, you're supposed to model that in as well. And it can also turn out that some of these things, which are based on best guesses and what you can extract from the data, which isn't usually the thing that you want to be able to extract from the data. Yeah, you can come up with a model that'll sometimes be a good match, or will at least tell you something. The mathematical models are not great at just flat out predicting the future because oftentimes their assumptions turn out to be incorrect. But when that happens, it actually tells us something. It tells us they can actually go back afterward. If the future doesn't work out, the model said this and it would turn out to be that, then they can go back and say, okay, something in our model was wrong. Let's adjust it. And so they can get better. They can get better at modeling this specific disease. And people have got a lot better. Yeah, but I would say you don't want to go just on modeling. You can also go on practical data. So when China reopened its schools, or announced it was reopening its schools, I think it was April 27th is when I saw the news story for it. Anyway, um, what was the number of cases like in China? And the answer was it was somewhere around an average, like a 7-day average of about 10 cases a day. And for over the course of a full month, the 7-day average had been at or below 100 cases a day in an entire country with something like 1 billion people. China. Yeah, China. Yeah. And so this is a reasonable guideline. Yeah. For somewhere like America, with I don't know if we have a third or a fifth of the people that you would have in China, maybe less. You'd probably want like a third or a fifth of that number. So you want to be waiting until like the entire U.S. is down below something like yeah, I don't know if 10 cases a day is probably reasonable. If we can sit at 10 cases a day as a nation, that vicinity, for about a week, then I'll be pretty confident that, yeah, we can open up. Now, the thing in China is that they actually had a little bit of a resurgence. They're dealing with it right now. They're back up around, I think, 60 cases a day, average 7-day window. And so they're still finding them. They're tracking them down, and the Chinese are doing things like testing all however many million people there are in Wuhan City. I think they did the same thing in Beijing, just like testing every single person and using that to sort of track down the extra cases that were going unnoticed. And these are things that we are nowhere near doing in the U.S. at the moment. I actually had a scare with coronavirus. I got pretty sick last week, and I thought, boy, I don't know. It's like ticking some of the boxes. Went and got a test. Turns out it was negative, which thank goodness it was negative. That's fine. Um, but when I was looking at the forums, on there it said that, yeah, we know the CDC recommends that you have 2 negative tests before returning to work. But insurance companies are basically pushing back against this. They don't want to pay. And unless you want to pay $120 a test, yeah, who's going to do this? We can't really recommend it because this is for your employer's convenience, not for your health. And just that whole thinking that this is all about employers and not about driving the number of cases down to zero is what makes me also a little bit crazy, because that's the only way we get out of this is by driving this infection down to zero until it is gone. Yeah. And everything that we're doing, all these little deals with the devil we're trying to make, where we're just like, I'm going to do a little bit of this and get these people together because I want to, need to, because we used to do it that way, whatever, leads to more spread. And more spread leads to more spread in the future and more misery and more dead people that don't need to be dead or could live for another year or two and die of something else completely. Yeah. Just, yeah. Over and over. I just really wish people wouldn't. Yeah. Anyway, yeah. So, yeah, when we get down as a nation to like 10 cases a day for about a week straight, then I think that's probably going to be fairly safe. We can open up all the schools across the country. Something like that would require sort of national level coordination. Because if you open up the schools in one place, you're going to have people that come from other places because people mix around and move around, and there would even be people that would travel to go somewhere where a school or a church was open potentially. Yeah, because people like things. Yeah, or wherever. Yeah, I think there's supposed to be a big NASCAR race in Dallas Fort Worth this weekend. So yeah, people travel for all kinds of stuff. It's not even just like the sensible stuff like school and church. Yeah. Ah. Anyway, yeah. So yeah, I think the point is that the U.S. has never even come close to the kind of numbers that we need to be seeing to be able to open up fairly safely. We are rushing it, and it's possible that China was rushing it. And if they're rushing it, they've been probably the most cautious so far. So that means that everybody else has messed up in the same way. Everybody else has tried to go too fast. I don't think there has been a country that went too slow, that kept things locked down longer than it needed to. I do not believe that has happened. So, yeah. And whatever. Let's make different mistakes. Let's not make this particular one again. I would say that's at least my take on it. I realize that's not going to be popular with everybody, but yeah, I just want this thing to go away. I really want this to be over. So anyway, thanks very much. This is Ask Dr. Ben.